Hello, I'm Dr. Ayan Panja.
And I'm Dr. Shanice O'Mara. Welcome to The Health Show.
Each week in this groundbreaking new series, we'll bring you the most important and dramatic health stories from all around the world.
We'll report on the latest advances in medical science, healthcare in the world's toughest locations, and show you how technology is transforming our lives.
From drugs and vaccines to surgery and nursing, you'll find it here on The Health Show.
But first, can you guess what this is? Well, it's been described as a big step forward in the fight against HIV. In an exclusive report for The Health Show, we've been to Rwanda to find out why the world is watching this little piece of plastic.
It might make you wince, but stay with us. You've never seen anything like this before.
There is a war against HIV infection and AIDS. This instant blood test reveals the winners and losers. For these teenagers, it's good news. The line in the top box means they're not infected, but the even better news is that they can reduce their chances of ever becoming HIV positive by taking one simple step, a step that could save millions of lives around the world. Circumcision.
Circumcision is the most efficient tool to fight HIV/AIDS. When you are circumcised, you have 60% decrease in the risk to be infected against somebody who is not circumcised when you have a risky sex.
This large protective effect was demonstrated by 3 clinical trials in sub-Saharan Africa involving 11,000 men. They showed that circumcision reduces HIV infection in heterosexual relationships. This proven effectiveness has prompted the Rwandan Minister of Health to set an ambitious goal.
Our target is to circumcise 2 million men, adolescents, adults and children, newborn, by the end of 2012.
But how can circumcision on this scale be achieved in countries like Rwanda, where the hospitals and professionals skilled in anaesthetics and surgery are in very short supply? Tzameret Fuerst heads a company which has created PrePex, the only circumcision device ready to market which doesn't need anaesthetic.
The PrePex device has been tested in Rwanda for the past year, and the outcome of these studies is a device that can conduct adult male circumcision with no needles, no knives, no loss of blood, safe, simple, and cost-saving adult male circumcision in resource-limited settings. The device works on a very simple principle. We essentially stop the flow of blood to the unwanted tissue, which is the foreskin. And the foreskin, over the course of a week, will dry up, become very, very dry. And then after a week, you're going to cut that foreskin off in the same way that you'll cut your nails.
The exposed skin becomes tougher and acts as a stronger barrier against HIV. Jean-Paul Betega, the military surgeon in charge of the PrePex study, explains.
Person living without shoes, they have very hard skin. They are walking on a stone every day without any wound. So it's the same thing with the penis. Once you remove the foreskin, the probability to have a wound is less.
In a country where there are only 300 doctors for a population of 10 million, Jean-Paul's skills are too valuable to be used exclusively for circumcision. PrePex's simplicity means that nurses can replace the doctor after just 1 week's training. The first task of the nurses is to choose which of 5 sizes to use. Once the circumcision line is marked, fitting the device is very straightforward.
You place this ring at the base of the penis, insert this ring under the foreskin, so now the foreskin is completely covering the inner ring. Bring this elastic ring right on top and release. The foreskin is trapped under the elastic band, stopping the flow of blood to the unwanted foreskin tissue.
The process may look simple, but it should only be done by trained medics. All the men receive group and individual counselling about safe sex.
It's important to remind ourselves that male circumcision is not the silver bullet. It's 60%, it's not 100%, which is why it's important that it's implemented as part of a comprehensive HIV prevention strategy.
After a week, the men return to have the device removed.
The foreskin will be safely removed using blunt-edged scissors that cannot harm the glands, cannot harm the penis in any way. During the whole procedure, really the only point of pain or discomfort is when you're extracting the inner ring, which will be like removing a bandage on a wound. It will be 2 seconds of pain and pop, it's out.
I
am delighted because I didn't feel any pain. I continue to do my job normally with no problem. I am not inconvenienced at all.
Before the circumcision, it was very ugly to see, but now my penis is improved. It's very smart.
People leave this circumcision with a smile. Nobody do the traditional crispation and frisson when you have that circumcision. This doesn't happen.
An earlier study of 300 men has proved that this method is safer, faster and cheaper than conventional surgical circumcision. And it's urgently needed.
Every 16 seconds, someone dies of AIDS. So the impact is phenomenal. And we're talking about roughly 4 million lives that can be saved over the next decade or so.
My dream is Rwanda and Africa, and even the rest of the world as a whole, being more safe by having their males circumcised and have less risk to be infected by HIV.